Hello, my name is Mark Baines, and welcome to video number 3 of 6 on assessments and the first client training session with Training Made Fun. Make sure you've reviewed the first 2 videos before moving forward. That said, resting heart rate and blood pressure. When assessing your client or potential client, resting heart rate is something we want to understand because that's basically your baseline. That's your heart rate when you first wake up in the morning, your first awake, conscious heart rate. That is 0% intensity. If you take it first thing in the morning and then you measure it for 60 seconds, or if you have a heart rate monitor, ideally, to measure it, that's your resting heart rate when taking the average of that over 3 mornings. Over time, assuming positive health, assuming positive behaviors, that heart rate should be going down or staying the same, should not be going up. On a stressful day when you get less rest or you're tired or worn down, stressed out, anything like that, anything that causes a negative response, your body's having a hard time dealing with some stressor, heart rate will be higher. If the heart rate is higher, as a general rule, if it's 10% or more higher, the expectation would be you'd lower the intensity or stress of your day if it's at all possible to do so, because the body's already stressed out to begin with, based on a number of factors over what's going on with you. That said, you want to gauge your training session between 50-55% of maximum effort or max RPE or of max heart rate, basically half of your full effort. Really nothing terribly intense. Shouldn't be getting out of breath. Should not be overly challenging. It should feel like something that's really, on a normal day, far too easy. Okay? That said, you're supposed to be doing that until that resting heart rate is normalized again. However many days that takes until you get through that stress or whatever it is you're doing. That rough general range of heart rate or intensity is supposed to increase natural killer cell activities to help strengthening the immune system, as well as help your body recover from whatever stressor it is or a number of stressors that you're dealing with. That's vital, and it's often overlooked, far too frequently overlooked for a lot of people. Resting heart rate is a vital thing to be measuring every day, especially under periods of high stress or greater challenges. Okay, 70 to 80 beats a minute for the average person is a normal heart rate. 50 beats a minute or less is more ideal. Just because someone has a lower heart rate does not necessarily mean they are healthy or fit, but generally speaking, if you have a fit, healthy person, and so they're in good shape, they're feeling good, their health is good right now, they're gonna have a lower resting heart rate. And generally speaking, someone under more stress or who's not dealing with stress well or has had poor health over a number of months or years is gonna have a higher resting heart rate, okay? That said, resting blood pressure, taken at the beginning of the session, usually on the left brachial artery, you might find that you might get the same blood pressure or relatively the same similar blood pressure on the right side, but the research would typically say to keep it on the left side as that's where it's always been done. That's where the original research was done. That said, if you measure it high, you'll want to wait at least 2 minutes before testing it again. And then, of course, ideally, that blood pressure with upper number would not be as high as 140 or above, and the lower number would not be 90 or above. Basically, systolic is the upper number, diastolic is the lower number. We'll explain more about that in a moment. But either of those numbers being that number or that level or higher is too high. Okay, that would mean if it's a normal day, but you thought it was a normal day and your blood pressure is that, then you're stressed out today. So back off, think of that same level of intensity really low. If this becomes a chronic problem or the potential for a chronic problem, we want to get checked out by a doctor to make sure everything is okay. There's not some underlying problem or something going on. Okay. That said, 120 over 80 is more ideal. Something we want to typically see on a more regular basis. The upper number 120 or less, and the lower number 80 or less. Okay. We'll come back to explain a little more about that in just a moment. With that said, when it comes to blood pressure and heart rate, it comes back to the heart, right? And the cardiovascular system, the primary pump for blood to assist the cardiovascular system, to assist really your body as a whole, is going to be the heart. The heart serves the body. When people talk about get your heart rate up, honestly, that just doesn't make any sense. If you're stressed out, your body's not dealing well with situations, you're going to have a higher heart rate. Why would that be a good thing? And generally speaking, the person who's the fittest person in the room is going to have the lowest heart rate relative to other people in the room. The person on a good day who gets good rest and goes out and works hard will have a harder time getting the heart rate up because the heart rate's responding appropriately and it's lower. It is never a good idea to seek the heart rate up. It is not bad if it does go up, but it is never a good goal to get the heart rate up. We can't make that any more clear. We'll come back to a little bit more on that. That said, what the heart does is pumps blood. It delivers oxygen and nutrients to the tissues. Okay, and of course, blood is red because it's delivering oxygenated blood with hemoglobin, red blood cell high levels in that blood. And basically, as it returns back to the heart, you're going to see blue, which is typically veins, right? Arteries are typically away from the heart, or they are away from the heart, usually delivering oxygenated blood, and it's red. And veins are coming back toward the heart, and you're usually delivering blue blood, essentially deoxygenated blood with carbon dioxide and other gases and waste products, okay? And when it comes back to the heart, it's going to come into the right atrium through what we know are known as the superior vena cava and the inferior vena cava through the lower side here, okay? And it's going to come in this right atrium. It's going to go down from the right atrium, down to the right ventricle, and then it's going to leave from the right ventricle, going to go up to the lungs. It's going to get there, as you'll see where it says lungs right here, right ventricle to lungs, pulmonary artery. Pulmonary artery connects the right ventricle to the lungs. So it's going to go to the lungs to get oxygen, right? The pulmonary artery is the only artery in the body that carries deoxygenated blood, okay? So the lungs are going to give it oxygen, get the blood oxygen, and they're going to come back down to the left atrium via the pulmonary vein, and then go to the left ventricle. It's then going to leave the body through something called the aorta, okay? And it's going to distribute throughout the body through arteries, arterioles, capillaries, and so on, delivering oxygen and nutrient-rich blood to the body, hopefully as needed. Now, your heart rate is the pumping of your heart, right? Generally speaking, again, fitter people are going to have lower resting heart rates. They're going to have, at the same level of activity, person who is the fittest in the room, in the best condition, the least amount of stress, and can handle efficiently the stress that's happening right now, is going to have the lowest heart rate, okay? That said, all we're really talking about is that contraction filling, that bum, 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 bum. That heart rate is contraction of the ventricles and then filling of the ventricles. Okay, the bigger boom is the contraction of those ventricles of the heart, and the softer one is the filling of the ventricles. Okay, that said, resting heart rate again is 0% intensity. HRI is the heart rate we want to know when they first walk in the door. You want to make a regular effort to ask your potential client or client when they first see you, what's your heart rate right now? And of course, they might go, I don't know, because they have no way of measuring it. Well, you can do the carotid artery up here at the neck, but a lot of times people put too much pressure or there's too much thickness there, and they don't really know how to measure it, what they're measuring for, and they have a hard time reading it. They push harder, it becomes less, they become less able to get a reasonable heart rate, reasonable reading of the heart rate. So, better place to do is probably going to be at the pulmonary artery on the wrist. And when you measure it there, you want to measure it for 6 seconds and then add a 0. That's going to give a snapshot of right now. Perfect world, you've got an ongoing heart rate monitor on, something you might want to consider investing in, and we'll talk about later as well, for you to have, for your client to wear the transmitter and you have the heart rate monitor, the watch, measuring the heart rate, right? To be able to see the actual readout of the heart rate. So we know ongoing what's going on at all times, ideally. But for snapshots, 6 seconds, multiply by 10, or give it a 0. Why do we do it that way? Because if you measure the heart rate for too long, you're seeing too much variability in what's going on. If you want to see what's happening right now, you measure it for 6 seconds. And that's why. Because it gives you pretty much a snapshot of right now. The longer you go, the more variation you're going to see. Not good or bad, but just be clear about what you're trying to measure. Okay? So perfect world, let's say your resting heart rate is 50 or something, 50, 55, maybe even 45 or lower, somewhere in those lower ranges, hopefully. Your HRI, you walk in the door to the gym, some people might be seeing the 70s. Some people might be as low as the 60s. That'd be pretty unusual to walk in the door of the gym halfway through your day or the end of your day and see heart rate only in the 60s. That'd be pretty impressive. A pretty low stress person right there. It is possible, but it's probably not real likely. More likely at least the 70s. You're probably going to see maybe the 80s or 90s, or even 100 or above, all depending upon the level of stress the person's undergoing at the given moment when they walk in the door of that gym, or they walk onto that track, or they go out the door to go for a walk, or they step on the tennis court, wherever it is you're going to be training. Okay, that max heart rate theoretically is the maximum amount your heart can beat. So max heart rate is theoretically death. Okay, it is not a good goal to try to get to. We're not trying to get that heart rate up once again. You're going to find the closer you get to the theoretical max heart rate, let alone the actual max heart rate, performance will decline. Why would we ever want to go to a place that performance declines when the heart rate gets that high? So consequently, we want to be paying more attention to the performance itself, be clear about what the goal was. The goal is to beat you up. Oh, we can do any number of things to beat somebody up. Specific goal towards strength or cardiovascular conditioning or whatever it might be. And we're going to look at the heart rate to see how the body's doing, but the primary goal is going to be, are we doing the exercise to the level we expect? And more importantly, can they recover and do it again? If they can't, heart rate's probably a little bit high. But that theoretical number, we still use 220 minus your age. Old school formula. Okay, it's not the primary formula used in a lot of programs for the American College of Sports Medicine and a lot of other institutes. They often use more recent formulas in the last few years. There's always a slight update to that formula, it would seem, every few years, and that's totally fine. There are more accurate formulas. Why do we say that then, that we're okay with 220 minus your age? Because all we know is you want to be nowhere near it. As an example, I'm 47 years old. 220 minus 47, that's 173. I've done numerous number of formulas over the last several years, and my heart rate varies in those formulas between 171 and 176. That's within 3 or 4 beats either direction. All I know is if I get anywhere near 170, you know what's going to happen to my performance? My performance can be really, really low. So generally speaking, I find with my high intensity intervals, I'm maxing out at my performance level when I start getting that high 150s. We're talking about like high intensity intervals. If you see my heart rate getting more in the 160s, I'll tell you what's happening. I'm slowing down. I can't lift weight as well. My technique is awful. So why would I want to go there? It's true of everybody. What their heart rate is when they get there, who knows? It's going to be higher heart rates for younger people, lower heart rates for older people. However, pay more attention to the performance. Use the heart rate as a gauge of understanding what's going on with the performance. Okay? With that comes to the training heart rate or target heart rate. We don't want to set a floor. Don't tell people try to get your heart rate above blank. No, we want to be clear about the performance we're aiming for, whatever it might be, number one, as we said. And then we might want to set a high of a ceiling. Please don't go above blank heart rate today. Or if you want to say you want to get your heart rate back down below blank in a period amount of time, typically speaking, we see high intensity intervals. We want people to get their heart rates down to like 120 or less in 90 seconds or less, preferably much less. If you can't get it down there in 90 seconds or less, you're doing some sort of high intensity interval of 30 seconds or 60 seconds or something like that, or longer. Okay, and we would say that the intensity of whatever you're doing is too high. It's not a good goal to get the heart rate up. Keep setting ceilings for heart rate as general ideas with performance, not absolutes. And please don't set floors. Don't set heart rates we want our people to get above. Let's not do that. That said, once again, normal blood pressure is 120 over 80. Some circles, medical circles, they refer to even more like 110 or 75 is even being more ideal or more of a health standard they want to seek. Fair enough, right? Lower and many, at least lower than that is going to be better. However, you can get too low. 140 over 90, or the systolic being 140 or above, or diastolic being 90 or above is too high. And keep in mind again, systolic, just like the heart rate, the boom boom contraction of the ventricles is the significant boom, and the softer boom is the filling of the ventricles of the heart. Well, the blood pressure is the contraction, that what they're measuring there, the systolic is measuring the contraction of the ventricles, the pressure on the ventricles of the heart. And then, of course, as it's filling, it's measuring the pressure for the lower number, the diastolic. That's what you're getting. The 140 over 90, the 140 was the contraction, the 90 was the filling. Or if it's 120 over 80, the contraction, the pressure on the heart is 120, and the filling was the 80. Okay? 90 over 55 is, generally speaking, the possibility of being too low. We say high. It's not like, or low. It's like the end of the world. It's too high. Or, oh my gosh, it's too low. It's numbers to be concerned about. Okay? And a doctor needs to be informed or checked in with if those numbers are consistent or seems to be unusually high for any normal, unusual or unknown reason, or if it's unusually low. Okay? And that set can be too low, that's often coupled with lightheadedness, dizziness. Every time someone leans over and they get lightheaded, popping back up. When someone's not eating enough food, not getting enough calories, not drinking enough water, too high a stress, they might have low blood or getting sick. All those numbers can be low blood pressure. Of course, it can also be high, all depending on number of stressors. Either one, we've got to be careful about. When you see those numbers engaging in those areas, it's time to get probably further help from a doctor to find out what's going on to make sure everything is okay. Okay? A Valsalva maneuver is basically when someone closes off the glottis. They're lifting something heavy, or something happens and it scares them, and like that sudden gasp motion or gasp when they actually incur a closing the glottis. Okay, whereby no more oxygen is getting through, or very little oxygen getting through, all depending, to the brain. Consequently, you're cutting off oxygen flow. So if you hold that, you're going to see a person change colors, right? You're actually going to see them change colors, and they're going to develop so much internal pressure. Short term, while they're doing it, the blood pressure actually drops, the heart rate actually drops. But the moment they breathe in again, right after it, heart rate shoots up significantly, and pressure is increased so much, the possible risk of actually bursting blood vessels, specifically in the eyes, are very, very high. And the fact is, when you're actually doing that, you're not breathing. You're actually going to be, and for longer term actions or repetitive actions, you're actually going to make it more difficult to produce proper force to be able to perform at a higher level. We don't want to see that. It's a real simple rule. We don't want to have someone ever practicing a Valsalva maneuver. It's a very natural response when incurring an increase in stress. It's very natural. It should be a fraction of a second that should go away. You don't ever want to tell someone to hold the Valsalva maneuver. That's never a good thing. It happens. It's going to happen. If you pick up a heavy weight, you're going to, when you pick up the heavy weight, but as soon as you pick up, you go, breathe as soon as possible. Exhale and breathe. Some people often ask us, how should I breathe when I exercise? Honestly, our response, yes. What do you mean yes? I want you to breathe when you exercise. Okay, well, how do you want me to breathe? That would be great. Okay, what? Well, we want you to breathe when you exercise, not worry about how you're breathing when you exercise. Not talking about meditation, not talking about some forms of yoga or periods of focus or someone just trying to relax. You want to focus on your breathing because the purpose of that point in time is to focus on your breathing. What you don't want to do in a heavy lift, or you don't want to do in a high intensity sprint, or you don't want to do in some high intensity exercise is think about your breathing. You're trying to think about how you're moving, trying to think about what you're doing. You shouldn't have to think about your breathing. If you have to think about your breathing, I know one thing, whatever you're doing is too intense for you. That shouldn't have to happen. So if you're having someone's engaged in that, closing that glottis off, and then they can't not do it, we know one thing, the stress is too high, okay? That said, and even more dramatic, awful things that we don't want to get into can happen with someone engaging in that Valsalva maneuver on a more regular basis. Not a good thing. The primary cause of a heart attack is blockage of the coronary artery. Remember we talked about coronary artery disease risk in the previous presentation, video 2 of the 6 for assessments and first training session. The primary cause of a heart attack is typically blockage of that coronary artery. Okay, there are a lot of things that can go into what's going on with the heart and problems with the heart, but generally speaking, that's one of the most probable causes of a heart attack, blockage of the coronary artery. That said, that blockage occurs. It can be chronic, something that's happening over repetitive stress for a long period of time, or it can be something more acute, some incredibly significant stressor. It's very unusual, but it can happen. People have heart attacks every day, unfortunately, for some unusual acute stressor that can't be explained. Well, we want to be able to minimize any possible long-term risk for such an occurrence. We hope you never have to deal with a situation where someone has a heart attack in your presence. However, if it does happen, you want to make sure you're AED CPR certified. Basically, AED is an automated external defibrillator. It's a little machine. You turn it on, it tells you exactly what to do as far as getting someone sustainable until time for the paramedics or the fire department or whatnot to arrive, medical personnel, professionals to help with what's going on and help this person recover from whatever is causing the problem in the first place. Our job is just to keep them alive. And the AED does a far better job than just manual CPR, which is why you want to have AED CPR certification. Please make sure you do that before you begin your job as a personal trainer. You actually have to get it in most situations before you actually take your certification exam, but really vital simply for your job as a personal trainer. Okay? With that said, we'll continue on with video number 4 of 6 with assessments and personal training first session next.